I'm a board-certified psychiatrist and have helped over 200 PMHNPs gain clinical confidence in their psychiatric diagnosis skills, their treatment skills, and helping them become better clinicians so they can get their patients better. In this video, I'm going to be covering medication anxiety and how you can help your patients get over this so that way they can actually start taking their treatments. A lot of patients will say that they are anxious to start a medication, or you might prescribe something and then you find out next month that the patient didn't take it for X or Y reason. And this all occurs due to medication anxiety. The patient felt for whatever reason that they were too anxious to take the medication, whether they were concerned about side effects, if it was a cost thing, if it was like a dosage thing, if it was a fear that they might be stuck on this medication forever. All of these are very valid reasons why a patient might not continue the medication. And by being aware of these reasons, then we can do our part to help make sure the patients are starting with their treatment, they stick with their treatment, so they can actually get better. And so in this video, I want to cover 3 things that we can do as providers, 3 things that we can say to the patient to help them take the treatment. And number 3, I want to say is reassuring patients that these medications are studied. So it's not that we're just like picking them out of a hat, but rather these medications actually have a reason for their use. If the patient comes in with depression, then okay, the medication is used because it's approved for depression. If they come in with PTSD, there's certain medications that are approved or have more evidence for PTSD. If they're coming in for BPD or bipolar or whatever, schizophrenia, whatever the issue is, the medications have studies on them. And so helping the patient just remember that okay, these medications have studies, there's evidence behind the choosing the medication. So it's not random, because that's a big fear that patients have, is that the doctor or the provider may just be like guinea pigging me and just like choosing something at random. So this can happen when you start a new medication. This can happen when you, let's say, add a new medication. The patient might feel like, oh, now they're just throwing meds onto me. So helping them realize that, okay, this is studied, even the augmentation, when you add in multiple medications, that this combination is something that's studied, for example, for treatment-resistant depression or bipolar, can be very helpful. So that's number 3. So number 2 is honesty. And what do I mean by that? What I mean by this is setting expectations. These medications, we know they have side effects. We know they have problems. They're not perfect by any means. We know that the first trial may not work. So setting those expectations for the patient is super, super helpful. Because when you set those expectations, then now let's say the patient has a side effect. Now they're aware of it. Now they don't feel like, oh yeah, this provider gaslit me. Let's say the first try doesn't work, the first SSRI after 6 to 8 weeks. Then you can say, oh, okay, well, let me try something else here. So that's the benefit of honesty as well, too, is that you are able to build the rapport with the patient. So it builds rapport and trust. And this also leads to hope. So the patient can have hope in their treatment. So just setting the expectations for side effects. So, all right, SE, so side effects, right? Trials, maybe multiple trials may be needed, can help build rapport and trust, and hope can help for the future too, sharing other stories. So this will be a side point here. So I'll write 1.5. So share success stories. It's one thing for the patient to feel like, wow, this is, I'm the only one that is going through this. But then it's another where, you say, oh, okay, I had X or Y patient who took this medication and they got better, or they did this treatment and they got better, or they came in with a similar thing to you and they got better. So immediately just hearing that, the patient feels that, okay, I'm not the only one in this situation, and that other people have gone through this, and that there was hope for them too. So that really also leads to the hope aspect. But then number one, and I think this is such an underrated thing that I've never heard anyone else talk about this, but f- increase their pain. So there's a saying that when people only change when the pain of staying the same is worse than the pain of changing. People only change when the pain of staying the same is worse than the pain of changing. If I touch a hot stove example, I pull back my hand immediately because I feel that pain, and the pain of changing my behavior. The pain of staying there is worse than the pain of just removing it. But when you have a frog and you put it in a pot to slowly boil, that pain is not enough for the frog to change its behavior. So that's why the frog will slowly boil. So that's why, with increasing their pain, remind them of the reason that they're starting this medication. They have X or Y problem in their life, which they want to solve with the treatment. And they're not going to be able to solve that. Sometimes, like, they might forget how bad their problems are. So by amplifying their pain, really saying, okay, how is this affecting your life? How is this affecting your marriage or your work life? Is this affecting your personal health? Is this affecting your enjoyment of life? Basically helping them realize how much is affecting their life can motivate them to take action and to follow through with the treatment, because now the pain of them staying the same, their current situation, is worse than the anxiety that they have to overcome to change it. Like, the pain of their current situation is so bad that they're okay with trialing something multiple times or having side effects with it because of this reason. And I've never heard anybody talk about this. This is a very common sales strategy where, if a patient comes to you, right, and let's say they have a problem, as a sales example, like let's say you're a mechanic and the person comes to you, and then as a mechanic, you're like, oh yeah, no, things are fine. This is good. This will last you a while. Now you've lost yourself to sale because now the person's driven out the door. But if you say, oh yeah, like, okay, this is going to be a problem, and like, this air filter, if we don't get it corrected in the next couple months, then you're going to have bad quality air, and then this exhaust, it's going to build up, it's going to ruin your engine, and then that's going to cause problems, and then this paint's it's not looking good either, right? And then now people will judge you for this, especially if you want to look professional. So now what you're doing is you're amplifying their pain, and you can, the mechanic could say, oh yeah, well, you already noticed that it kind of sputters right now, right? You don't want this to keep on going on. So you amplify the pain so that way the person is committed to taking action now. So underrated strategy, really focus on that. And this is kind of the framework that I go through when I'm trying to help patients get over medication anxiety. And so if you want to learn other tips and tricks like this and how I am able to help my psychiatric patients, and so you can become a better psychiatric provider, best place to do that is in our PMHNP coaching program. We've had over 200 students join and stay through so far, and they're really learning a lot to become excellent clinicians to serve their patients better. If that interests you, you can check that out. Otherwise, I will see you in the next video.